definitely wanted to learn about more in-depth pieces of variant interpretation,
I was really hoping just to learn what variant interpretation involves.
but I really wanted to know when they're looking at the data that they use to classify variants, how are they looking at that and thinking this is a valuable piece of evidence, or this is enough to push a variant, or this is not enough to push a variant?
Like, does it involve actually building the tools to learn more about your variants and your genes, or is it more about just using resources? And if it's using resources, how do people use the resources to come up with these short blurbs of like how deleterious or how beneficial a certain variant may be? And I was pleasantly surprised because it was way more than that.
You don't know what you don't know until you get into it. And so I knew a few things that I wanted to learn from the certificate, and it just went far beyond my expectations.
In addition to the work that I do, I perform genetic test adjudication. So, this is reviewing genetic testing for patients to see if they meet the genetic eligibility that is becoming more and more common for clinical trials. So, that means I need to be able to understand the nomenclature in these reports. I need to confirm that the appropriate testing had been performed, and then using that information to determine whether that patient is eligible for these gene specific clinical trials.
Well, I was hoping to learn the HGVS nomenclature and more information about current testing methodologies used in the clinical lab, and that is exactly what we learned. We spent a lot of time on all of that.